Hello everyone, this is Big Northern Bear, and I'm sad to report that after 677 days of being AFib free, I found myself back into the ER, and I'd like to talk about it. If you're new to the channel, welcome. I host a little show that I do intermittently called the AFib Show. Up until recently, I've been 677 days AFib free. I accomplished this through lifestyle modification, lost 110 pounds, I've cleaned up my diet, I've cured my sleep apnea, I'm no longer pre-diabetic, I no longer have high blood pressure, I exercise regularly, I run regular 10Ks, I've gone off all kinds of medications, but again, the point I keep trying to make is that AFib is a progressive disease, and it only took me going on vacation for about 8 days and not minding my food, and AFib came back. So I don't really know why specifically I ended up in AFib. I may never know. That's the nature of it. You sometimes don't know what individually triggered you. I suspect that the day that my AFib returned, I was experiencing some gastric reflux, something I haven't had in 2 years, and GERD is highly associated with AFib, so I'd have to say the most likely trigger was that, but there was other things that happened that day. I had just returned from a long drive. I'd driven from Ottawa back to the Hamilton area, and had a small dinner, and then after dinner I went out and did a 5-mile run on a trail, rather hot and humid, and I found that to be a little bit taxing, but not overly so. Went to the grocery store after that and returned home, and then I got in a hot shower, and it was in the hot shower that I felt it happen, and I was like, oh crap, this isn't palpitations, this is the big deal. So I grabbed my little portable ECG, and it wasn't saying AFib, it was saying tachycardia with ST depression. So I did it 4 or 5 times, because you know sometimes these machines they don't interpret so well, but if it comes up with the same result a few times, you can usually count on that. So I'm madly Googling what this is, and it's definitely a possible sign of a heart attack. And I was like, well, I was out running in the heat, I've had a taxing few days on vacation, I can't just take my pill in the pocket, I'm just gonna have to go get checked out. So my wife drove me to the hospital. In we go. By the time I got there, my heart was doing all kinds of crazy stuff. In fact, it was kind of stumping the doctors and nurses. So what was happening is my heart was going through all these different arrhythmias. It would go through VTach into what they call extreme VTach, or ventricular tachycardia, which is a really rapid heartbeat that's led by the ventricular pacemaker, or ventricular ectopics, whatever, but it's being driven from the ventricles. So it would flip from that, it would go into atrial fibrillation, then it would go into atrial flutter, and then I'd go into sinus rhythm, and I would spend about 30 seconds to a minute of each, and sometimes I would go into VFib for 5 or 10 beats, and then back into VTach, and then into flutter, and then AFib, and then sinus, and then AFib, and it was just a roller coaster ride with seemingly no end. And I put in the beginning of the video, of the introduction, the alarm that went off every time my heart would switch from one rhythm to another. So apparently there's no way to silence this alarm. They set the thing to be the least sensitive, and the only way to silence is that every time my heart would switch beats, someone would have to come to the machine and push the button to acknowledge the alert. Well, the hospitals here are pretty short-staffed, so the result was hours of this thing just going off every 30 seconds when my heart would switch beats, scaring the bejesus out of me and my wife and anyone who's on the floor. I heard people in the next room asking, is that guy in there going to be okay? Because they could just hear the alarm going off over and over. And this was someone else who was in a cardiology care ward worried about me, right? So it was pretty freaky. Well, the long story short of it, because of the way my heart was behaving, they were really reluctant just to give me an electrocardioversion. And they were really reluctant just to give me a pill because they wanted to see the results of the blood test first to see if I had a heart attack. So the way these tests work is they test your blood for, like, your heart has chemicals that leak out during a heart attack that they can then pick up in your bloodstream. There's these proteins that will leak out during a heart attack. So you should only sense what they call elevated levels of these proteins if you've had a heart attack. So it's a pretty definitive test to see if you've had a heart attack in the past. I think you can even test from a few days ago to today. So they wanted to make sure I hadn't had a heart attack before they tried electrocardioverting me. And so they did a whole bunch of other blood tests along that. Of course, they test my magnesium and potassium and sent them down to the lab. Well, unfortunately, Ontario is having a major healthcare crisis. Turned out that in this particular hospital, all the beds were full, and they're short-staffed, just like everywhere across the province right now. I guess that was the same deal with the lab, because my results took a long time to come back. So as a precautionary measure, they just went ahead and hung an IV bag of magnesium, and because that's pretty safe. I mean, there's really no danger from having too much magnesium. There is for potassium, but not for magnesium. So they started that, and it was of no help. The test slowly started coming back after a few hours. It was around hour 3.5, hour 4, they decided to give me some metoprolol. Very small amount, because I have a low resting heart rate. So even when I was in sinus rhythm, my heart rate was very low. And if you can hear my dog barking upstairs, I apologize. But so they gave me just 12.5 of metoprolol, and after about half an hour, when there was no change, they gave me another 12.5. And you know, we just carried on, and finally the results came back that it wasn't a heart attack and that my electrolytes were all good. So we're relieved to hear that. They were still uncertain as to whether they wanted to electrocardiovert me or not. So the doctor was texting the cardiologist, who actually remembered me from the last time I was there. I guess you know, I'm one of these unique cases that people remember. And she decided, well, what worked last time was the flecainide. So they were, because my heart kept trying to go back to sinus on its own, it was actually succeeding. It was going back to sinus rhythm on its own for 30 or 40 seconds, and then the other rhythms would jump in. And there was a real battle, since there was a battle going on between, you know, sinus rhythm and the other rhythms. They thought all they had to do was give me the edge. So rather than giving me the typical 300 milligram dose I've been prescribed, they just gave me 100 milligrams of flecainide. And an hour later I converted, and I was in sinus rhythm, and I stayed there, and it was locked in. And it felt great. Now, the interesting thing about this particular visit with all these rhythms is you think I would just be knocked on my butt. But the fact was, except for my heart jumping around, I felt fine. I had no shortness of breath, had no dizziness. I walked myself into the hospital while my wife parked the truck. I felt just fine. I mean, the doctor asked me, "You don't feel anything at all?" I said, just the crazy palpitations going on in my chest. I feel like I could be lifting weights right now. Like, I really did feel fine. And the feedback I got the next day from the cardiologist really was insightful on this, and I'll get into that in a moment. But so, of course, because of the nature of the arrhythmia, they weren't just going to say, okay, you're in sinus, off you go. They're going to keep me to monitor. So they kept me to monitor. During this time, they had done a chest x-ray, and I guess that had come back showing a little possible, what they call an intrusion, which is basically suspected infection in my chest, which sort of made sense because I was in Ottawa at a water park, and it was really cold when we were there. We had this freaky cold day in August, so we were shivering our butts off on the water slides all day. So I thought, well, maybe I did catch a little something during all that. Who knows? But around 9:30, 10 in the morning, I had been up all night, no sleep, just exhausted. And then the day shift staff came to see me. They brought me a little breakfast and told me that I'm probably being admitted. I'm like, what, being admitted? You don't even have beds, and I'm in sinus rhythm. Why are you going to admit me? She says, well, I think the cardiologist is going to come see you shortly and he'll talk to you. So, okay, great. So the cardiologist came in and he said, well, now that I see you, I don't think I'm going to admit you. You look quite frankly strong as an ox. He said, I can see there's no edema in your feet. I was kind of worried when I saw your chest x-ray that, you know, you're having a bit of heart failure and maybe some fluid was backing up. So given that's not the case, he's a lot less worried. So I asked him about the possible chest infection. He said, well, the x-ray was not ideal quality, and they had done it twice, and both times it wasn't perfect quality for whatever reason, but he suspects it's a possible infection. And we talked about, you know, how I've been AFib free for so long, and how that, he said, you know, for 4 hours your heart just kept fighting its way back to sinus on its own, and we hadn't given you any treatment. He said that's all your running and exercise paying off right there. For all you know, that saved your life tonight. For all you know, that your heart was fighting its way back. So up until that moment, here I had been sitting and feeling like a total failure, that all this work I had done for nothing, that I had not in fact pushed back against this progressive disease. It just marched on anyway. But that felt good to hear. And he said, you know, this is why, he said, I've never seen anyone with rhythms like that have no symptoms and be able to sit up and talk to me. So that's a real testament to the work you've been doing. And no matter what, when you go home, as soon as you feel up to it, go back to exercising. So, and you know, this is a cardiologist talking, and that felt really good, that I had been doing the right thing for the past 2 years, and it made me see this more as a bump in the road rather than a failure. So that felt really good. So little did I know I was not out of the woods yet. So he came back and he said, okay, we're discharging you. Before you go, we're going to give you an IV of antibiotics. Excuse me while I cough. An IV antibiotics, and just, you know, give you a head start. We suspect you have an infection, but we're not sure, and we don't want to risk it. And he gave me a prescription for antibiotics, and I am just staying on flecainide now, small dose every day. I'm just going to stay on it. I had gone off it about 8 months ago, so obviously I should have just stayed on it. My metoprolol staying the same. So really the only change in my medication was going on this antibiotic for a week and going back on a small dose of flecainide, 50 milligrams twice a day. So I go home, finally sleep. Oh my God, did I ever need sleep? And I slept all through the night, woke up at 5 the next morning, took my medications. I can normally take them at 5. Decided I could go back to sleep a bit longer, so I did. I woke up at 6 and my skin was just covered in hives, and I told my wife, we have to go back to the hospital. I'm having an allergic reaction to this antibiotic. We didn't even get to the car when we were calling 911 because I was starting to feel I was not breathing. Now I'm fortunate enough that I live within about 180-second drive for the ambulance to my place, and they were there in about 180 seconds, and they gave me adrenaline in the ambulance and Benadryl intravenously, and by the time I got to the hospital I was okay. I was breathing fine and I was quite comfortable, but I still had to spend another 6 hours at the hospital being monitored and a few other tests, and they gave me a shot of steroids and they gave me a shot of high potency reactine, he called it. And after 4 hours of being monitored, they felt comfortable. I was out of anaphylactic shock, and they discharged me again. And I got home, and an hour later I had to go back to the hospital and get a holter monitor that I'm now wearing for 7 days. So I've spent a lot of time at the hospital this week. It was not the week I had in mind. Today, although I felt okay going through it afterwards, I've just been exhausted since. I don't know if it's just going back on the flecainide and I need to adjust again, but I've been really exhausted. And the big thing is I'm really heat sensitive. So yesterday morning, which was, let's say, my first full day out on my own, I did a very short jog. I just did a 20-minute very easy jog and a 20-minute walk, but I did first thing in the morning. I did in the air-conditioned comfort of the gym. This morning I did a half an hour jog. I mean, these are nowhere near what I'm capable of doing, but I just wanted to do a little something. I'm more like testing myself to see if I'm comfortable just, you know, doing a bit of work. But both yesterday and today, after I was just exhausted all day. Today at lunch I did a easy mile on the treadmill. I mean, I was only on 2.8 miles an hour, just an easy walk. And after that I was just exhausted. I checked my blood pressure. My blood pressure is lower than normal. It's at the range. It was at 118/60, and whenever the bottom number, the diastolic, gets down to 60, I really feel it hard. I get dizzy and weak, so that explains that. So obviously my blood pressure is a bit too low right now, and it's all just carryover from a very long, difficult night. I feel like, you know, my heart's just sort of exhausted, and it's craving rest, so I'm giving it rest. I didn't work this week. Fortunate enough to have a supportive company, and they just, you know, just rest and get better. And I'll be returning to work Monday, and you know, I'm really grateful for that. And I'm really grateful that, you know, I have this really supportive wife who just puts me first during these times, and she's there for me, and she sat with me all night and drove me back and forth. I don't know what I'd do without her at times like this. So excuse me. But that's it. So I'm getting used to being on the medication again, and just reflecting on, you know, just how quickly, after 6-7 months of diligent effort, just going off the rails for a week can really just set you back, and it's really not worth it. I mean, it's fine to have a cheat meal or a cheat day, but you go on vacation and you take a week or two vacation from doing what you need to do. I mean, you're just as much as at risk as if you had never started. So that's a big lesson learned for me. And as well, the GERD is interesting, because looking back on the gastric reflux I was having the day of this, I was having that a lot back when I was having regular AFib, and you know, they're definitely related. So did that specifically trigger me? I don't know, but the GERD, the long run in the heat, the exhausting day of driving, probably all contributed somewhat and became sort of the perfect storm. And then when I got into the hot shower, that was the final little push over the edge into AFib. So I was reading, for those who might be interested, I actually have the medical report. I can log into my hospital and I can read the medical reports afterwards, which is great. So I really do follow up on these things, and I like to read what the doctors say. So just making sure. Okay, so this is my report. Admission diagnosis: admission due to sustained palpitations, found to be an atrial flutter. So I was actually, the main rhythm was atrial flutter. Discharge diagnosis: the same rhythm control achieved by adding antiarrhythmics. Past medical history, okay, we know all that. But I guess I'll just jump through it. Known history of proximal atrial fibrillation, followed in the community for 2 years. History of multiple visits to the ER, last one from 2 years ago. Overall improved control with significant weight loss, improvement in obstructive sleep apnea and regular exercise. Hypertension, history of obesity with significant intentional weight loss. History of sleep apnea. He was on a CPAP machine. Tells me he's not using it currently, given the improvement in the degree of his obstructive sleep apnea. So that's true. I no longer use the CPAP machine because it no longer helps. It does nothing now. I don't have sleep apnea. So List my home medications. Patient was admitted early morning, August 10th. Well, it was actually August 9th, late at night, but you know, interim admission via emergency room physician regarding multiple episodes of palpitation and atrial flutter. Patient is in good general condition over the past couple of years, lost weight, started exercising regularly. Okay, this is our review. In the emergency room, he was found to be an atrial flutter with a rate of 130 beats per minute with a 2-to-1 conduction. So that means 130 beats per minute, 2-to-1, so every 2 beats of the atrial, I think it's 1 beat of the ventricle. He received flecainide and metoprolol and converted to sinus bradycardia at a heart rate around 48 beats per minute with no concerns. He did have some episodes of non-sustained atrial flutter, atrial fibrillation, possible atrial tachycardia. He had 5 or 6 beats of wide complex tachycardia consistent with non-sustained ventricular tachycardia or sustained ventricular tachycardia with aberrancy. That's a nice way of putting it, aberrancy. Overall, he had no significant system chest x-ray revealed possible infiltration on the right side. So that's where they were thinking of. Had the infection, has mild leukocytes count, so that's my white cells were a bit high. 12-lead ECG from presentation revealed evidence of atrial flutter, rare PVCs, non-specific ST changes likely related. So, care plan, resume flecainide 50 milligrams twice a day, metoprolol twice a day, continue with the blood thinner. Yeah, all basic stuff. So anyway, I gotta say that the hospital did its usual great job of taking care of things even though they're really stressed. And I'm really grateful that I have a hospital like this nearby. So thanks to any of those who end up watching. Anyway, it was a really stressful night because mostly this frickin' machine and the alarm going off. This thing is PTSD inducing. Now, even my wife who sat through with me, she says, every time you text me now, I just jump. I wonder if there's an emergency. And she's even got some trauma induced from this machine, I'm sure, just from sitting next to me all night with this thing going on. This is a terrible thing. I don't truly see the need for it to be so restrictive. If the nurse and doctor are watching over me, surely they can just silence the alarm so that's not traumatizing their patients. So that's the learning experience that I would think that if someone in hospital administration's watching, that's the learning experience there. Anyway, I just wanted to just discuss this setback and just be honest with my viewers that, you know, I haven't cured this thing. I'm just put it into remission for almost 2 years, and I intend to do it again. So I intend to start doing it again. I mean, I know the path. I just have to stay on the path. So, you know, if you're religious, welcome your prayers. If you're not, I welcome your good thoughts. And you know, if you have a heart rhythmia disorder, I mean, like and subscribe, follow along. There's not a lot of stuff out here by patients for patients. There's a lot of stuff from the white coats, and God bless them, and they have good information. But trying to build a community by patients for patients, especially around AFib here on YouTube. So thanks for your time. Thanks for tuning in. You have a wonderful weekend and a great day.